Artery disease is the #1 killer in the United States, but it is preventable and it is reversible. And Dr. James Mickle Jr. is Santa Fe's only board-certified cholesterol specialist and can help you avoid a heart attack or stroke. Good morning, Dr. Mickle.
Good morning, Nikki. Thanks for having me.
Thanks for being with us. I don't think a lot of people were aware that it really is the #1 killer. So could you define what artery disease actually is?
Sure. Artery disease we talk about is usually the cholesterol penetration into the blood vessel wall.
Okay.
And cholesterol is obviously going through the bloodstream. And our job is really to keep it in the bloodstream and keep it out of the blood vessel wall.
Absolutely. And there are some symptoms that we need to watch for so that we don't obtain artery disease. So what are those symptoms?
Sure. As the arteries become compromised by the cholesterol, it's the usual ones we're pretty much familiar with. Chest pain, shortness of breath would be for heart events. For events for the brain would be mentation problems, weakness in an arm, and circulation problems in the lower extremities sometimes turn up too.
Is it a myth? I've heard people say, I know when I've been with my grandmother and her friends sometimes, when they get a pain in their left shoulder, they have said that maybe that is an indication.
There's a little overlap there, but there's so many other things that can make that a complex picture. It's tough to count on that as the primary indication.
Okay, so we'll just keep in mind those symptoms you mentioned. And what are the causes to getting those symptoms in the first place?
Well, it's the cholesterol, which we're all blessed or maybe cursed with an overabundance that goes back to our ancient ancestors, but we don't need all that cholesterol, and by accident it leaves the circulation and will get into the blood vessel wall.
Okay. I mean, is a lot of it genetic though as well?
Good bit of it's genetic, but the usual risk factors we think of: blood pressure, diabetes, cigarette smoking, and of course cholesterol levels. The field that I'm in has sort of responded to the fact that we know that even if we address all those things real well, there's a whole lot of people that go right ahead with their vascular disease. So the disease has progressed, or the science has progressed, and the specialty has tried to incorporate the new research into that.
No doubt. I mean, and these risk factors are things that, you know, I said at the beginning, you can avoid. So you can avoid getting to the point where it's past the point of no return, can't you?
Sure. You can avoid lifestyle, and is very helpful. Sometimes genetics can compromise the situation, but they're even still very addressable.
Okay, good. And your practice certainly will help us get to better health. So tell us a little bit about that.
Yes, so our field, it's a clinical specialty in cholesterol. It's called lipidology.
Okay.
But it's basically selected out all the known factors that affect blood vessel disease and has gotten way beyond that really to very specialized laboratory tests.
Okay.
So really when we see elevated cholesterol, that's sort of the start. And we don't really know if that's causing a problem. We try to evaluate each person and say, does this person have disease? And then use the advanced laboratory test to find out exactly what's causing the disease. And
you actually do use an ultrasound of the neck artery. So can you tell us about that procedure? I never heard of that before.
Well, with the ultrasound, it's a very good way to visualize the artery itself. And here I'm using this probe on my patient, and I'm looking at his neck as the blood vessel runs from his heart on up. The blood vessel is running horizontally with his heart to the right side and his brain to the left, and I'm looking at the thickness of the straight part of the artery right now. As I move on a little bit farther up on that artery, we'll see a plaque in this patient. The blood is just going over a little bit of a mound there that you can see. And we're measuring the speed of the blood going past. And then we'll see a plaque. Now this patient of mine was a young man. He had a number of risk factors, and I didn't really think he was going to have any disease just because of his youth. But I was surprised, because when you look at the ultrasound, you actually will see some plaque development, and there it is. The very bright white spots in that plaque represent calcium, which to a doctor is a reassuring thing because it's the end stage of healing. There's initially cholesterol, then there's calcium.
You know, and I mean, obviously, not being somebody that's trained in this, I would never know what to look for. It's amazing how much you can learn from this. And I guess now, from that point forward, now we have to talk about what the treatment would be if there is a problem.
Yes, and we use the laboratory tests. The risk factors are pretty easy, blood pressure and so on, and we can counsel about that. But the laboratory tests will show us almost in every single case why someone has blood vessel disease.
Really?
And that's an advancement, because most doctors are still working on the pattern of looking at an LDL cholesterol and writing a prescription. But that's not the way we can be doing it. We can be much more precise and much more correct.
Interesting. And you can also do procedures and treatments that will allow somebody to have a fuller, longer, healthier life.
Sure. as you approach all these different components of the disease, the cholesterol will stabilize and will actually start to leave the blood vessel if it's in a fluid form yet.
So interesting. It's amazing. And I would love our viewers to know how they can reach you, because sometimes you don't, as you said, somebody that was young, you didn't think that he might even be at risk. It's interesting that sometimes we just don't know until we check.
Yes, there are a lot of surprises, and I'm in Santa Fe on Calle Medico in Santa Fe, and my phone number is 699-1172. And a phone call there will just get you lined up, and I'd be happy to take a look. It's a lot of fun. It's very graphic. It's not frightening. There's no radiation. You'll enjoy it.
We definitely appreciate having an easy consultation that's painless and helps us live a longer life. Dr. Mickle, thank you so much.
Thank you there, Nikki. Appreciate it.
We appreciate you being here. And we're not